Hi, my name is Lisa Gibbons, and I'm an OB-GYN with Cascadia Women's Clinic in Vancouver, Washington, asked to talk about self-induction labor techniques. This is a question that we get asked very frequently, usually about the 38th week of pregnancy, term, or your due date is set at 40 weeks. So these ladies are very excited about seeing their baby, they're very excited about getting their body back, and they're ready to have their baby out. Ways to stimulate labor run very abundant on the internet and from anecdotal conversations that you'll have with pretty much anybody on the street about how to induce labor. Unfortunately, from the medical community standpoint, we largely don't know what stimulates labor still, and it's a medical mystery overall what the message is. It's either sent from the baby to mom or vice versa to start that labor process. I think we would all enjoy knowing what that was to make our patients more comfortable, make us not up at 2 o'clock in the morning if possible, but unfortunately that's still largely unknown. There are lots of different things that are described as possibilities to induce labor, and I'll run through a short list of things with our conversations that we typically have with our patients in the office, because they're things that you'll hear often, but most of them largely don't work. Walking or exercise is something that we hear frequently, and I certainly encourage exercise in pregnancy. I think that it's something that helps ladies to stay fit, feel good about themselves, bounce back after pregnancy, and also have endurance during the labor process. However, there's been no evidence, medically speaking, to show that it helps to induce the labor process. Some more aggressive things that people have tried, castor oil or enemas. These, I think, are kind of a bad idea. I've seen it once, and it was a pretty unpleasant experience for the lady involved as well as everybody else. Nausea, vomiting, diarrhea is largely the result of castor oil, and I think it's more an irritation to the uterus as well as significant dehydration, and can make a pretty messy experience of it if it works, but oftentimes doesn't, and you still get those side effects. So not something that we recommend certainly in our office. Nipple stimulation is something that the midwifery society or the midwifery groups often prescribe, and is something that does stimulate oxytocin and uterine contractions and will occasionally start labor, but it's a pretty aggressive schedule that has to be performed in order to achieve those contractions, and some ladies report that they're increased pain with those contractions. I've had some ladies that have tried this and have not had success with it. However, it's something that you can talk with your practitioner about. Also, sexual intercourse is something that you hear frequently. There is some evidence to show that this may be beneficial because of the prostaglandins in the semen, as well as with female orgasm, uterine contractions and stimulation of that lower uterine segment. However, again, it's not foolproof. Massage, acupuncture, or acupressure are things that are becoming much more commonly talked about. There are some acupressure or acupuncture points around the ankles, so if you're going in for pedicures or massages during pregnancy, most of the time people will avoid this area, especially early in pregnancy, and maybe something to look into, but again, not something that that we've seen a lot of research on, and from a medical standpoint would like to see more data regarding those possibilities. In summary, I think it's important to remember to talk with your OB-GYN about when it's safe to try some of these things. You know, there's all sorts of stuff, including herbal remedies and things that people will try. But again, the side effects and safety of these things aren't well documented and known. And so talking with your OB-GYN about when it would be potentially safe to try some of these things, because you want to make sure that your baby's old enough and developed enough to be born, but also remember that it will happen and your baby will come.